Welcome everyone to another edition of WebGyan. Perhaps some of you have been here before for some of our earlier installments. We've had a number of very exciting talks by top experts in different areas, talking about different facets of the COVID and the COVID crisis. And if you would like to watch past episodes, many of them have been archived on our WebGyan webpage. So you can watch talks by people like Gagandeep Kang and Manu Prakash and Shahid Jamil, etc. So a lot of very good talks there. If you haven't visited the WebGyan webpage, it's covid-gyan.in. WebGyan is a unique initiative across various institutions in the country. Some of the top institutions in the basic sciences. In particular, the TIFR system in Mumbai and all the centers in Bangalore, Hyderabad, Pune, etc. And as well as IISc, India Biosciences, and Tata Memorial Hospital. So several partners in this unique initiative who came together, scientists scientists as well as communication experts and outreach, science outreach. People all came together to try to communicate accurate science about the COVID and the developing science as well. So you will find on our webpage articles by some scientists from across these institutions, explaining in an accessible form some of the scientific developments that have been happening in the last several months. And we also have infographics, videos, and in short, it's for communicating science in an accurate and reliable, accessible way. There are also resources on well-being and other things in the time of lockdown. So I'm sure you'll find a lot of interesting stuff there if you go and browse. It's also there in about a dozen Indian languages. So that's something else we are trying to increase the amount of content in all the regional languages in India. So that's something to make the science more accessible. So this is sort of a snapshot of what the WebGyan initiative is, and the WebGyan is one of our flagship activities in this. We are also going to, in the coming months, roll out some other exciting new initiatives, like some training modules and short story competition and for youngsters, etc. So please stay tuned and on our webpage or through the WebGyan series about the things that we are doing on this front. So I'll now hand it over to Professor Prahlad Harsha from the TIFR campus in Mumbai to introduce the speaker, Professor Kamakoti. And I would like to extend my thanks to him as well for agreeing to speak in this WebGyan series. Over to you, Prahlad.
Thanks, Rajesh. Yeah, so since the beginning of the pandemic, we all know that contact tracing sort of plays a big role in trying to understand how these pandemics grow. And in today's world, one is more interested in digital contact tracing, and India put in a big step in this direction with the Aarogya Setu app. And we're very fortunate today to have one of the people who were involved in the making of the Aarogya Setu app, Professor Kamakoti, with us to share with us his thoughts on contact tracing and Aarogya Setu in particular. A couple of words on Professor Kamakoti. Professor Kamakoti Veerinathan is a professor at the Indian Institute of Technology, Madras. I've known him actually since my undergrad days at IIT Madras. He specializes in the area of computer architecture, secure system engineering, VLSI design, and HPC, high performance computing. He has won several awards such as the IBM Faculty Award, the Academic Excellence Awards instituted by DRDO, the IESA Techno Visionary Award. And we're very happy to have him share with us his thoughts on contact tracing and the excitement that went into the making of the Aarogya Setu app. Professor Kamakoti.
Thank you, Prahlad. Thank you. Thanks all for giving me this wonderful opportunity to address all of you. So I'll just take you into the journey of building of a very large-scale data-driven system. And I'll be spending around 20 to 25 minutes on this. And then we'll have around 15 minutes for questions and answers. So this is how I've organized the talk. So I'm just sharing my screen. Prahlad, is the screen visible?
Yes, it's visible. It's visible.
Yes.
Yeah.
So I'm presenting my complete journey of building a very large-scale data-driven system. And I would like to take Aarogya Setu as a case study because this is really a large scale, because more than 15 crore users are using currently, and it is highly data-driven. So I belong to the Pratap Subramaniam Center for Digital Intelligence and Secure Hardware Architecture. It is a center sponsored by one of our alumni, and we belong to a group called RISE Group of IIT Madras. So if you look at, a picture talks million words. Of course, data can give us million insights. And that is what we have learned from this entire experience of Aarogya Setu and the subsequent backend data analytics that we do to find out regions that are sensitive to COVID or sensitive to spread of COVID, and go and do some containment there to reduce the spread and try to bring out some control over the spread of the disease. So this is something, the experience that I would like to share of running this app over the last 4 months, of being one member of running this. Many people were involved, and what are the different aspects of that. This also lays a very interesting, and as we are moving towards digital India, as we are trying to bring in more AI, as we are trying to make cities smart, this gives an excellent case study of what will work, what may not work, what are the things, what are the basic building blocks, and what it means to build such a system. So that is a very, very important case study, which through Corona, we could have learned it through other means, but unfortunately we had a pandemic here. But that pandemic, of all the bad things that it has done, certain good things, one good thing is that it has educated us how to build such large systems and what are the real things that we need to keep in mind while building such a system. We should also understand that the picture will speak million words only if it is properly drawn. And similarly, the data will give us million insight when it is properly sensed and properly analyzed. So the analytics part is also very important. The sensing part is also very important. And so how do we actually build this system, and what are the things that we need to take extreme care while building these systems is what I would like to present in the next 25 minutes. When we start engineering a large-scale system, right, so we have three essential components here. One is the edge sensor, right, the sensor which basically senses the data. And then there is an intermediary system which collects this sense data, does some processing there, right, and to ensure either a good communication efficiency, or to ensure privacy, or to ensure security. So it can do many things. So there is an intermediary layer which sends the data, which collects the sensed data and does certain processing there. And after that, this data is pushed to the cloud, where an analytics system. So when we are engineering such large-scale data-driven systems, right, we have three components here: the edge sensor, the intermediate data aggregation, and the cloud analytics. And in each of these parts, there are challenges, right? So and the way we look at it, even by looking at this figure, we know that this is extremely interdisciplinary. And this is an example of a cyber physical system. So cyber physical systems are going to be quite the technology as we go down the line. And this is indeed a cyber physical system. And then there are extreme care that we need to take. Ultimately, we want to build a software that works and that gives us proper insights. So we need to take several amount of care at the sensing, at the intermediary level, and at the cloud analytics level. And so what are the things that we did at each of these levels is going to basically determine the success of the system. And that is what I'll try and explain as we go out. So the nature of the project, as I mentioned, is extremely interdisciplinary. If you look at Aarogya Setu, it involved computer scientists, right from people who can write software, people who understand networking, people who understand the operating system, people who understand the databases, people who understand AI, people who understand machine learning, right? So quite a significant amount of people who has to take part in this. In addition, we also needed performance engineers who can certify that the system can stand the load that is that to be imposed to while it goes to production. Then there is a bunch of security engineers who certifies that the different aspects of privacy and security as a document, a legal document that comes that this is the privacy and security undertaking that we give when you install the app and we are going to collect data from you as an implementing agency, right? There is a security team which comes and sees whether all these rules are stated are compliant with. So this involves, if you take a BTech curriculum in computer science, every core course has an impact on this particular development. Then we need epidemiologists. I'll tell you where they fit in. Then we need statisticians who understand statistics. And then we need some amount of humanities and social sciences, basically from a perception point of view. And of course, the legal, basically certifying on the privacy point of view, because this is a contact tracing. There are different manifestations here. For example, privacy here, the notion is that we are now talking of a pandemic where there could be asymptotic carriers. I really don't know whether I have the virus or not, but I have the potential to have the virus and spread it. And in this context, I'm moving out and I'm going to different places. I'm getting in contact with others. So what is my responsibility about the information that where I am in versus information that whether I could have possibly spread the virus in case I am detected positive, right? So this is a very complex scenario, and that is where the privacy has to be maintained to a maximum level. At the same time, we have to share our details because we could have spread certain diseases which could have impacted other people. So that this is a legal framework that we need to work out. So these are all, and there could have been many. I could have missed something, but overall, at least 5 different disciplines, and within each discipline, you have several sub-disciplines are involved in making this system. Now, if you look at the development cycle of this system, so there is a software requirement specification. I'll come to that very shortly. Then there is a great amount of functional testing, which essentially says what I want is what I am getting out of the software environment. Then there is performance testing. Then there is security testing. Then you go and deploy this. Then the most important aspects are end user acceptance. Will the end user, will people start using it? And then once they start using it, start giving out data, then after the usage, we need to do certain inferences and then get out something considerable, effective actionable items that we need to get out of the software. So these are all the things. The entire development cycle is based on all these points. And I am going to use Aarogya Setu as a case study to explain all these things, what it means to bring up this very, very large scale system. So if you look at SRS, the software requirement specification, you have an edge, intermediary, and cloud. Now, for any such system, the DNA of any smart city or any of the cyber physical system is one intuition. And what is the intuition here? which is the most important seed for the system, COVID, of all uncertainty that it gives, it says 15 days later it will come, it may not come again, it will be there. After 1 month, you will get some virus infection. So many things. You eat garlic, it will go off. You eat garlic, it will not go off. So many WhatsApp messages and other things we are seeing in the thing. There's so much uncertainty about that. But one thing certain is, it is certain to spread through contact, which is this contact is measured as a function of proximity and the time the two people spread. For example, A is positive. The potential that we will get it is if A has been close to B and for some amount of time, then there is a chance of him getting, of B getting infected. So this is something which is certain. And last four months, as we are running this app, we find that this is really certain. We have more than 25, 26 lakh cases, and many times we find that, or almost all the time we find that this has been a part of a contact that has actually spread this disease. Now, when we look at the edge level, we wanted a sensing mechanism. Bluetooth is one which can be a very good sensing mechanism. Why Bluetooth? Because when two Bluetooth devices come together, there is a strength of the signal that we can measure, which gives you a clear characterization of the distance, right? And then the duration where two Bluetooth were in close proximity can also be inferred. So the two basic inputs that are necessary for contact tracing essentially comes from Bluetooth. Or today, on all the mobile phones, if you put together union of all these mobile phones, the one common feature that is, or one common peripheral that is available, which could be used sensibly for measuring the proximity and the amount of time they were close to each other, is the Bluetooth. So what happens here? User A and user B both have installed Aarogya Setu. Both must have installed Aarogya Setu, and they should keep their Bluetooth on, right? And they come into close proximity. Then the detail of A. So first and foremost, what you do is that when people register onto the site that they want to become a subscriber, we give them a device ID, a unique device ID, so that their mobile number is not leaked out. Only the device ID is, and the device ID is known to the server and to the person, so nobody else knows the device ID, right? So there is an anonymization of the mobile number that is done at this point itself. And so if A actually comes in proximity to B, then this Bluetooth functionality, this edge sensing mechanism, records the distance and time of contact along with location information in both the mobiles, along with the unique ID of the other. So A will get B's device ID. He will not know what is B's mobile number, and he will know that the location where he has come and amount of duration of time and the proximity, distance proximity. So I know that I have come in close contact with someone, some DID, to whom I don't know exactly the person, at this place for this amount of time at this distance. And that is very clear. And this is very important. The reason that why we give the DID is, in the event A becomes positive and he starts looking at B, and then we really do not want him to know why he got the disease. Rather, we want him to know he got the disease, but through whom he got the disease, because that can result in other type of complications. Okay, so clearly this anonymization happens here, and so A will not know B, and same B will not know A, and the common link between them is through this unique ID, right? And this is what happens at edge. So to sum up, A and B has Aarogya Setu, they have registered, they got a unique device ID for their mobile number, which they alone know, the other person doesn't know. The A and B comes in close contact with each other. So A's DID and along the distance and the contact information, the duration and the lat long will be stored in B and similarly in A, right? So this is what the edge part of this, the sensing part of the data does. And then there are challenges here. For example, the Bluetooth working in different handsets and different operating systems, different drivers have different manifestations. So there is extensive testing that needs to go on to see this mutual interoperability of several Bluetooth devices, though Bluetooth is a global standard. Okay, it's a standard protocol, but still there were a lot of interoperability testing that had to be done, because two Bluetooth have to talk to each other. And when that Bluetooth is on and some other thing, your headset is connected, what will happen? And so many different things have to be done here.
Kamakoti?
Yes.
This one. So in general, I'll defer questions till the end, unless they seem very contextual. I will. Is it okay if I ask questions?
Yeah, we can keep it at the end, because I'll quickly finish and we'll have.
Okay, sounds good. Okay.
So the important factors that came into this point at this sensing stage itself is we build this app privacy first. Then next came the security, where the security is because we need access to, there should not be any access to personal data. The personal data, of course, we collect its name, and also if you enter a wrong name, still it is okay there. But then the age is becoming important, because people above 60 or below 10, they say that they are more vulnerable to be affected very quickly by the disease. And then we do have the sex, because people of males got more affected than females. At some point of time, if you look at the gender ratio, males were at least 2/3 and females were 1/3. So there can be a prioritization there, because we didn't know who is what this virus is affecting whom and how and when. So some preliminary personal details are there in this effect only, and then these are basically stored, and so we are extremely very taken care of the security. And the other thing is that we had to also keep this. We have to see that no chaos comes out of this. Suddenly somebody becomes, somebody announces that they are positive, and everybody else, who came in contact becomes positive. Then it should not create a chaos. I'll give you some scenarios where we have carefully evaluated these things. So after the sensing, when we went into the intermediary level, which is the mobile phone, which is collecting this data, and then when we moved on to the cloud, these two aspects were centric when we made every decision there. Now let us go to the intermediary. Intermediary is a mobile phone, which was through the app stores like the Google Store and the iOS store, and now it also went on to KaiOS, namely the Geo feature phones also had this. So the mobile phone, which is downloaded through the app stores, it keeps the sensed data in encrypted form, and it interfaces with the cloud. So every data that is sensed is not sent to the cloud. The first data when a person actually does this, the enrollment, that is the point where the data is stored, and then every time he does a self-assessment, he or she does a self-assessment, saying I'm having cough, I'm having fever, loss of taste, smell, or difficulty in breathing, that also will be stored in the server. Okay, and any other contact tracing and other informations are kept exclusively in the mobile phone. It is not taken to the server, and any of this any other data will be discarded within 15 days. So today minus 15, any time before that, the data that is collected will be automatically discarded. And these data are stored in encrypted form within the mobile device. So these are all some of the important care that we took, keeping in mind again privacy and security very clearly. So this is the intermediary app. So this also allows user to upload self-assessment at regular intervals, that whether they have cough, fever, loss of taste, smell, and difficulty in breathing. These are the 4 prominent symptoms that were there for the COVID. And at the cloud level, there was a self-assessment data. So what does the cloud does? It takes the self-assessment data uploaded by the user. So the user submits, I have this cloud. It takes that data. And for all positive tested patients, so we get this patient is positive from the ICMR. So ICMR says these are the patients, these mobile numbers, they are tested positive. Now the cloud makes them as positive. We confirm them as positive. And why should the cloud do? So there has been a debate that the individual can himself say that they have become positive. Why should the cloud say that? So this was one scenario that we were worried of. So the scenario where we are worried of is that somebody, just to create a chaos, can self-certify. They can go to a big mall and or some crowded place, and at the time, this lockdown were not clear when the software has been made. But then still today we have a lot of crowded places. It's not that in spite of lockdown, whenever there is a relaxation, just go to a crowded place, get a lot of contacts, and then self-proclaim saying I'm positive. Then all the people around will get affected, and then that could create a chaos. So that is one of the reasons why let us define who is confirmed as positive. So the confirmation as positive comes from the cloud. Then once a person is confirmed as positive, then from that mobile number, we take all the contact tracing that they have done. And then there is an epidemiological, this is where epidemiologist comes into play. There is an epidemiological model that is there. I'm not going to the model, nor I'm an expert in that model, which analyzes this contact trace information to classify each contact as high risk, moderate risk, or low risk. Right? This depends upon the time and the duration, etc. So that's a model that certifies that these people. And then immediately, so what you get there, we get only the DIDs. We don't get the mobile number. Then it is going to a central database. From the DID, they map it onto the mobile number. So A has test positive. In A's mobile phone, there will be some 100 DIDs, let us say, which have come in close contact. Then the epidemiological say that out of this 100, this 50 are high risk, this 20 are low risk, and the remaining 30 are moderate risk. Once that is done, then these traced DIDs is taken to the database, and from that the mobile number is found. And those mobile numbers are informed, saying that you had come in touch with some person. We don't say which person, right? So please go and have a check, right? And depending upon the risk factor, go and check. And this is the entire operation, and it also gives additional information to users about this infection spread in their proximity, like in the next 50 meters, 100 meters, 200 meters, how many people are infected, how many. It only gives you aggregate information. It doesn't give you any personal information. It gives you aggregate information, so that when I'm moving from, say, I'm going from here to IIT, I should know, okay, in the mid area like Alvarpet or Koturpuram, how many people are affected, so that I get an idea that I should, if I am going by a public transport in the event after some time, then these informations are going to be extremely useful for us. And this is also gives some other informations like nearby test centers, etc., which would be useful for somebody to handle COVID crisis when it hits the family, right? So this is what the cloud level does. Now, after all these things, we need to have certain actionable items here. So what is it that, after all, we are collecting all this information, the self-assessment information, the contact trace information is there. Now, what is the action item can we do from here? So, for example, we are getting around 200,000 self-assessment plus trace, and it will keep increasing. So somebody says, I'm having cough, what we do in return? Can a single entity do the follow-up for all these things? And how do you physically reach these people? Go help them with testing in a lockdown, or they don't have a test center nearby. They are immobile, right? So how do you go and test them? How do you go and help them? So the system will be certainly useless without any of these follow-up action. There should be some follow-up action, and that is where an entire amount of backend has been built. Now, if you take country has a very good administrative divisions. Like we have states, within states we have districts, within district we have pin codes, and within pin codes we have sub-post offices. Right. So India has around 155,000 plus sub-post offices, and each sub-post office, depending on the area, can have different population density. If it's a city, it will be even 20 lakhs. But if it's a village, then it can be anywhere between 2,000 to 3,000 also. And for every sub-post office, there is a latitude and longitude. So there was also a debate why we need this latitude long. Why are you collecting, the lat long information? The reason is, so what happens is that we have the lat long of all the self-assessment. I do a self-assessment. I say I'm doing it from here. So the lat long comes. We don't know the exact area. Similarly, when a Bluetooth tracing is happening, the lat long comes there. So with this lat long, we can actually find out which sub-post office they belong to. And then we give the report to the sub-post office saying, in your sub-post office, say these people have called. Why don't you go to the health worker, to the health department? We give them at a sub-post office level, go and do a follow-up with these people, so that they get that help. And that is something which is the biggest thing. So one of the big challenges that we faced is, we have a lat long. We need to find out the closest sub-post office to which it belongs to. And the closest is measured as the lat long between the distance between the two latitude and longitude. And so we needed a queryable structure. So this is, I just wanted, since I'm a computer science professor, I just want to do at least one slide in computer science. So I just do this. So what we did was, we actually divided India into a set of grids. These are very representative. This grid, we have made grids of 100 meter cross 100 meter. And so every post, so this will be, it will be several tens of thousand rows and tens of thousand columns. And every post office, which had a sub-post office which had a lat long, is mapped onto a box in this grid. And given a query point, we find the box B to which it belongs to. And from that box B, we search for the closest box to B, which is having a pin code mapped, right? So we have 1,55,000 points, which are sub-post office. Given a query point, which is a lat long, we'll find which is the closest point by searching these boxes. And every sub-post office we provide, and then we know that this is very close to this sub-post office. So we go to that state, that district, that pin code, that sub-post office, and say, these many people have called from your sub-post office, these many people have been traced at your sub-post office to the health worker. Go and follow up and see if they are fine or they need any medical attention. And this is happening on a continuous basis, right? So to do this, this is how we do. So that the small point you see at 1 is the query point. And so we start searching. We start that box. Then we search the next 2s, then the next 3s, then the 4s, and so on. So within some 4 or 5 levels, we were able to, around 10 levels, around half a kilometer, we were able to find one pin code, one sub-post office, and so we associated with it. So we used hash tables, floor functions, and this matrix is very sparse. There's several tens of thousand rows and columns when only 1,55,000 points are mapped. So we used a very simple hash table, and this solved the problem. So this has been one of the basic building blocks where we were giving some actionable items here. So, and in addition to this, statistics actually played a very crucial role. So we had teams from Indian Institute of Science, also and IITs, plus a lot of volunteers from industry who came forward to contribute to this. Based on this self-assessment and trace details, which are now mapped on to specific areas like sub-post offices, the statisticians actually performed a syndromic mapping, which predicts the presence and spread of the disease in a given area, which can be mapped onto the sub-post office area. So essentially, we say at every 100 meter cross 100 meter grid, we can say what is the amount of disease that is there, what is the amount of exposure. So we have the data from the Aarogya Setu. We have also ICMA data, which basically gives us some information about which district and which pin code they have come. And by this, we were able to actually find out at every sub-post office area, we were able to point out, and we were taking the last 15 days data, because 15 days is sensible. Beyond 15 days, they say that the spread is not going to be there. So whoever, how many positive cases have come, how many people have reported syndromes, how many contact tracing has happened. The contact tracing tells how much movement of COVID positive patients have come in and gone. So we only give aggregate information. We take aggregate information, no personal information is given here. So the aggregate information is given. And from this aggregate information, we classify each area as very high risk, moderate risk, and low risk. So 4 different types of classification. And then this pointed areas within the sub, and within that, suppose since we have 100-meter cross 100-meter level information, so this is one supposed office which is high risky. In this, you can go and concentrate on these small packets, and then basically trace for these people. And if there is trace in the sense that see if they are fine, if they are having fever, if their oxygen content is fine, if they have other symptoms, do a continuous medical follow-up. By this, do this. And this particular thing enabled what you call as catch early and contain early protocol. Catch the patient early, catch the virus early, and contain it early. And this protocol was conceived by Ahmedabad Municipal Corporation. And then currently it is adapted by multiple districts of Gujarat and hopefully other places also. But Ahmedabad came out with this protocol in a very big way to start with. Now, I just want to give the whatever has reported in the press. So around May 27th, Aarogya Setu to pinpoint future hotspots in Ahmedabad. This was come in TOI. TOI has been covering this in quite detail. And so around May 27th, June first week point, where Ahmedabad was actually doing little worse in the sense that there were a lot of positive cases coming, and then mortality was also high. Ahmedabad started this in a very big way. And by July 23rd, this is what has happened. So I just want to point out two ellipses on the left-hand side announcement, where you see that the total positive cases in 1 month from June 17 to July 17th has come down from 330 to 187. And it was in June 6th when they started, it was actually 500. And the deaths, importantly, see this positive active cases is one part. As long as somebody goes for 4 to 5 days in quarantine and come back safe, then it's fine. Death is something which is more. Death was dipped from 22 to 5, while June 6 it was around 40. So 40 to 5, and last several weeks, if you look at Ahmedabad, it is within that 5 range. And then there were a lot of forecasts for Ahmedabad. So there were a lot of teams who are doing forecasts, and the decay. See, there is something like it becomes a peak and then start decaying. This is what many models project as a forecast. But then that fall down was very, very linear, right? So there's a very smooth gradient. But this particular intervention made it very steep. So that, at least, if you can say that at least 4 weeks advance, if I say that deaths will become 5 in say second week of August, this actually became good at second week of July or third week of July. So at least 4 weeks in advance, this fall could happen. So this is one interesting case study. After that, many districts of Gujarat are following, and I hope other cities also are maybe following. But we are giving this information for all the cities and states to act upon. And these are some things that are reported in the press. And the 2 real reasons behind the success. See, data is like a placard. If you go to our East Coast Road, they say Pondicherry 160 kilometers. The placard will not come with you. You have to drive the distance. Placard will only tell this is the direction. If you go 160 kilometers, you'll reach Pondicherry. The placard will not travel with you. So this is very important in data systems, right? It didn't work means it's not data system's fault always, right? So there are 2 main reasons behind success. And I think people who are from different parts of the country, if you see COVID growing in your place, you can basically help your administration by doing one of these 2. One is from the government side, there was a dedicated team at Ahmedabad Municipal Corporation which worked round the clock. It's not a simple work, it's very, very difficult work. We were just giving them data, but this is from this Aarogya Setu app, but this is something which is very, very important. And people did submit the self-assessment and carried mobile phone keeping Bluetooth on. See, unless that is happening, then we will not get the real heart of the information. Right? Every other information is going to be. This is going to basically give us the real place and contact where we can basically go and arrest this. And this was a very important public responsibility by which we can take certain pointed action, because this virus is completely unknown, and that it can spread as an asymptomatic person can be a carrier adds a lot of uncertainty to this virus. And this is something, these two, in my opinion, are the real reasons behind success. The data and other things can be there, but ultimately the system succeeds only if the end user cooperates and the end user acts on this. There are two end users. One is the health department of the government, and another is the general public, and both have need to cooperate to make this successful. Now, there are human aspects here. First thing is that people have to trust that this app is serving yourself and the country. And another thing is it can be deleted. If you are not comfortable with the app, you feel it is going to affect your privacy and security, you can delete it at any time. And trust is something very important. See, trust is, we are now giving you a mathematical system, right? This is a computer program, right? So this is a mathematical system, and we say trust it. Trust is something which is, which has transcended all mathematical properties of a definition. Definition A is equal to B is definition, right? So the left-hand side is that definition, B is the defined path, A equal to B. And for equivalence, there are three relations. One is reflexive, another is symmetric, another is transitive. Trust is not reflexive, right? Sometimes you don't trust yourself. Trust is not symmetric. A trusts B, but B may not trust A. Trust is not transitive also. A trusts B, B trusts C, A need not trust C. So the three relationship that are necessary for equivalence, trust doesn't obey that. I mean, trust doesn't satisfy that. And trust is also highly temporal. Morning you trust me, after evening you don't trust me. So ironically, the whole society has been running on trust. That is very centric to using such type of important. And that is one human aspect that we need to. We are also trying to study it from an humanities and social science perspective. The success of the system has a very important component from that, right? And so there were concerns regarding privacy and data security. So explanation of working of this app and the privacy and data retention process, all these and policies were made public. It comes with the app. You can download and see that. And at a later point of time, after the system stabilized, say around a month or so, once it got stabilized, and the government actually opened up the entire code base for everyone to verify. So this is basically what they have done to tell people, yes, this is trustworthy. Now, I just want to touch upon next few minutes. I think I have another 2 more minutes. Okay. So the background side, there are a lot of things like there's an application development, there's a client which works on the mobile, and there's a lot of compatibility issues. Android version XXXXX, iOS version XXXX, handset version, so many things. And then there's a backend, which is a cloud, and we have to look at scalability. At one point of time, when the Honorable PM launched it, we had 25,000 hits at a single point of time. And then there should be a lot of APIs, secure APIs given for this analytic purpose, which gives you the aggregate information with sufficient amount of anonymization, etc. And then there's a performance testing that needs to be done to ensure that this app will scale to that level. So there was the IIT Madras open source tool called Apido, which was used for this. It's an open source tool developed and for an application which has under 15 crore people today using it. But till today, we did not have a performance bottleneck in that. And so we saved up to a couple of $1 million if a commercial tool has to be used. It was close to $1.5 to $2 million license for that level of testing. And then security testing, we did advanced penetration tests for protecting data. And then the data analytics part is again based on an open source stack from IIT Madras. I suggest you can have a look at datalibre.org.in. It's an open source stack. So the software we did not pay in 1 rupee. It's all, and it's all indigenous. It's all indigenous in the sense it's all collection of open source, but put into into a system by us. So this was the first show of Atmanirbharta, that we have our own software which we can take forward. And so there was a pre-production performance assurance testing which was done, which does stress testing, reliability testing, capacity planning testing, SLA-based testing, service level agreement, key transaction, all the transactions have to be, and then the regression test. So this is all completely done, for sustained usage. So this is one very important aspect. And then the complete, the security, because we are taking personal data, we are responsible for the data. So there's an extensive offensive assessment methodology that was done, followed to do both the application layer and the OS architecture layer assessments to ensure that the software is really secure and people cannot get into it and get the data leaked. And then we had this completely open source data analytics stack where we ensured both encryption on both data at rest, data at motion, and we had all the good development schedules that are done for the data analytics. So this is what I just wanted to present. So to sum up, this has been an exciting journey to make a large-scale data-driven systems, and highly interdisciplinary, and we got to work with different people working on different areas, not just computer science. And it also taught us in the pandemic a good thing of how to make a smart city-based system. So what are the things that gives us a completely great experience there? With this, I open up for questions. Thank you very much.
Thank you, Kamakoti. That was a very enlightening talk. Thank you. So we have time for questions. There are actually lots of questions out here. Questions broadly come into three different classes. One is the effectiveness of, the first being the effectiveness of contact tracing apps and Aarogya Setu in particular. Second is certain implementation questions related to the Aarogya Setu app. And third, and where most of the questions do come from, are privacy concerns that go into this one. So I will sort of do a mix of all three so that we don't focus too much on one particular this one. So let me start off with one of the questions. So this is more related to the effectiveness of the contact tracing apps and Aarogya Setu in particular. So for instance, a lot of cities in India have been closing their public transportation, to various measures over the last several months. So how effective is data from Aarogya Setu can be used? For example, in Bombay, the trains have not been operational since March or so. How effective is, or is there plans to use data from Aarogya Setu app to find out about how to get public transportation back under full this one? So how has this gone into this one? What can Aarogya Setu app, the data from Aarogya Setu app offer in this regard?
Yeah, so there are two inputs that we get from Aarogya Setu. One is the assessment, self-assessment that people do, and the second thing is the contact tracing. In the absence of a public transport system like this, of course, the contact tracing may be less because people are not going at close proximity. But then the self-assessment will be there at any affected place if people decide to do that self-assessment. The success of this will essentially come when people first start using it. I think another double, like today 15 crore people are using it. And I think surely another 15 crore can use because that many smartphones are there. And then now Jio has also brought, and they have a lot of customers. So one of the things is that people can start using this and they keep the Bluetooth on. Then this essentially becomes a very good way of tracing. We have seen instances where this tracing gave us something like 30%, 25 to 30% positivity because very focused, right? So this is one patient A became positive. People in their proximity, we go and start testing. So many of this high risk category that the epidemiological model says, they were tested positive. So this contact tracing has been very effective in that way. But a lot of adoption, if people adopt this to a large extent, especially when they move into public transport, in the event of us unlocking, and then the vaccine taking more time to come, there may be a period where we have to operate before the vaccine. And there, this contact tracing app will certainly be of great use in quickly knowing about your status and quickly testing and containing it. Doctors also say that when the symptoms come early and you come early and you start your zinc and vitamin C and your simple, so the solution is very simple: vitamin C, zinc, and something. That's the spread is less and the virulence is less. So this catch early, contain early protocol will work with that. So this is my take on this. So,
yeah. So this related to something you just now said, and actually question of Prabhakar Rajagopal. He asked this, as you mentioned a couple of times, both right now in the answer to the previous question and earlier in the talk, the efficacy of the app heavily relies on the number of people who will be using the app. Do you have minimum numbers for this? It's a slightly longer, I'm going to mix a couple of more questions, related questions. Do you have data on how much you would need for the app to become effective? For example, even, so there was an article in the Lancet about a week ago, which basically took a summary, a systematic review of contact tracing app across various nations and finding out this one. And in fact, the results seem to be suggesting the other way around, stating, they seem to be saying contact tracing app could potentially reduce transmission, but with sufficient population uptake. And even two of the most effective countries which have used contact tracing, Ireland and Germany. Ireland is 37% of the population uses the contact tracing app, Germany 20%. And the claim is both these numbers are far too low for things to fall in place. And the article, in fact, goes to say large-scale manual contact tracing is therefore still the key in most contexts, and not digital contact tracing. So you have, what are your comments on these? Because India is still far behind. Of course, we have the most number of downloads with respect to Aarogya Setu, but that's just because of the sheer size of the country.
Correct. So there are two things. One thing is manual tracing is still happening. So manual tracing, so they actually close within 72 hours, contacting 2 levels or 3 levels of contact, they do the tracing. So that is certainly happening. And we should also note that if you look at as a country, we have more joint families, so one effect is actually equal to some 4 or 5, 6 people getting affected. We don't have a data as such, but what my sincere gut feel is that this is, if you just take at clusters of 4, then we are looking at 120 by 4, which is 30 crore families, more of this, an average of 4 members from a family. And so if each one member of a family has got, then we are almost 15 crore would be 50%. So this is another way of looking at it. The other thing is that this being a function of social distancing, I think we have predominantly a lot of rural districts. The spread has been in metros first, as you see, Delhi, Madras, Chennai, Hyderabad, Bangalore, large cities, and then the tier B cities. So if we are going to get this app well much done in many of the congested areas, densely populated areas, even within cities, I think that would be excellent contribution here. Rather than saying that the entire country of 120 crore should have this app, if we say that within one particular area of this population density, highly congested area, if those areas get it, I think that will certainly reduce the incidence. So this is certainly one thing we agree that we need a lot more members to use it to make it effective. But that effectiveness cannot be just a percentage of the population, but percentage of the distribution of the population and the density of the population. And we still believe that once the congested areas get this, at least wave 2 can be stopped in a very considerable fashion.
So we move on to an implementation question. So this is regarding the Bluetooth, the use of Bluetooth. So mentioned that one of the things that we need is distance between the two participants. You need to know this one. But in the case of Bluetooth signal, we heard that it's not very straight clear what's the relationship between the Bluetooth signal value and the distance. So how does one in the implementation issue estimate distance from Bluetooth signal values?
Yeah. Okay. So see, always best is the enemy of good, Prahlad. Okay. So we basically give a lot of tolerance limit. I didn't personally implement that, but the way I've understood that implementation from an outsider's perspective is that we give a lot of tolerance limit. Other important thing is also, as I mentioned, this was the interoperability that plays a very important role there. Okay, the thing that I sense from an Apple and an Android phone talking to each other, that could have there are many other issues that need to be handled. So that's a good tolerance limit and given, and this basically gives us an absolute figure of strength of the signal being received to fix the high risk and the low risk and the other risk. And many times it has been more pessimistic in the sense that, okay, even if this is the range, let us make it high risk so that it is, what does it mean that you go and do a test? So that level of tolerance limit has been put, because as we understand, yes, Bluetooth is characterizing Bluetooth is not, as the person who has raised the question has correctly put forward, characterizing the Bluetooth is not an easy stuff. So within that limit, a lot of experiments have been done, and we do give a little bit pessimistic model in the sense that it gives you a higher risk if there is a doubt, so that you go and do the testing. So this is how we have handled.
Okay, so this is okay. So this is a next question, both on implementation details and privacy concerns. So one thing was question is what happens to all of, is there, so India doesn't have a formal data policy and yet. So what happens to, is there a sunset clause to the Aarogya, the data in Aarogya? So I'll ask, I have a little more details. This one, there's both one concerns about, is there a sunset clause? What happens at the end of the pandemic? What happens to all this data everywhere? And this one is what happens is this one. Other is, this is from Professor Vijay Chandru. What are the plans for making this rich data set into a public good by making it open after appropriate anonymization and privacy preserving ethical consideration? This data has been contributed by citizens and hence belongs to them. It would be invaluable as open data for students, researchers, health solution providers, payers, and public health agencies in understanding the epidemiology of COVID-19 and being better prepared for the next one. I think K. Subramaniam has a related question, which is whether this anonymous data will be made publicly available. So these are two sort of contrasting things. Is there going to be a sunset clause in which the data is going to be destroyed at the end of the pandemic, or what's this? So is there any thoughts on this, or what has gone into?
Right. So there are two sets of data. First answering Professor Vijay Chandru's question, there are two sets of data. One is the personal data. Like, is there a sunset clause? The Sun actually sets for a given data, the setting clause is 15 days, and if they become positive, it is 30 days or 45 days. That policy is there in the Aarogya Setu app itself. So your data, whenever it is taken, first and foremost, there is a self-assessment data that is going there, and that data essentially is retained when when the person becomes positive. It is 45 days or some small. I don't remember the exact date, but there is a definite date where the data will be erased, and the contact tracing also. The contact tracing even does not leave your mobile phone unless it is. Unless you test positive, right? So till that it is staying on your mobile phone and automatically it gets erased within 15 days. So for all the data that is personal, that involves your age, what we ask, especially your sex, your age, your symptoms, and your name and your mobile number. So these are the 5 things that are asked there, nothing more. And also the profession, because we asked for the profession because we wanted to distinguish frontline workers who had to, for example, doctors or bankers, etc. So other than this 5 or 6 questions, there's no data collected. And these data have a sunset clause by itself, by the data retention policy itself. We don't retain that. But answering Professor Chandra's question is that aggregate. After that, we aggregate. Okay, so many people called from this place. That has nothing personal there. It is, say, 100 people called from this place, 1,000 people called. This aggregate information will be there, right? It is because we need to see the progress of the disease. And this, after the endemic or whatever this corona ends, the government may take a call to say how does thing spread at these places over last last 6 months or 8 months on a daily basis. That data the government can release, but I don't know whether they will, but they can. But there will be nothing personal or thing to anonymize that. So this is something which can be there and which can be used regarding the spread of the disease. But these all will be aggregate information and no personal information. For every personal information, it automatically has a sunset clause as given by the privacy policy. And the other thing is that once this endemic ends, this whole app, this system that has been developed, if it is proper, it can be used for other vaccination and health programs also. We can modify and use it. Right? This entire effort may not go as a waste, but anybody who wants can delete it. So that's a sunset clause for them to delete it.
Okay, and the question, let me move on to a data privacy question. This is a very general question, and possibly address several things about this. That is, almost most of the apps, very few, most of the apps seem to have some issue with privacy or not. There are a few protocols. For example, you have the D3PT protocol coming up, the trace contact number, which possibly the Apple and Google been using. These seem to have slightly better. So why is there a clear, what is the notion of privacy that these things of it? It's one thing is saying that there's a private data, the individual data is being deleted off this one, but that doesn't, it's not a guarantee of privacy in any sense. So one of the concerns, the first question was, Aarogya Setu has major concerns, in fact, with respect to this. How safe and wise it is to use it, and how safe is it to make it mandatory on as large on large sections of the population as is the case?
So I don't understand what privacy is being leaked out here. For example, so because I as A will not know anything about B as a part of this entire process. The information about A is stored in a server which is not accessible to B, right? So any personal information about B will never be known to a person A and vice versa. This is completely ensured as I described here. Even we only put the DIDs, and the DID to mobile number mapping is not known. Given a DID, I don't know whose mobile number it is. Then there were concerns like, why are you asking for name, age, etc. But even here, if the name is misspelled, you don't give your sex or age, still the self-assessment goes. But the mobile number and location data are important, because without the location data, I cannot make it actionable, right? So in a country of 120 crore, there's no way by which we could make it actionable, right? And the location data has been extremely useful. I have shown the Ahmedabad case, where it has been used extensively, and we have brought it. Today, the death rate is 5, and while it was 40. So this is very important, because I want to take some action. I really need to know where you are. And the other part is, can you make it voluntary? The other connotation for that is that if somebody says, I am positive, so how many people will come forward and say they are positive? After they become positive, the tension would be to get rid of the disease rather than going to Aarogya Setu and saying I am positive. Okay, and so how much time? So the other thing is the other model, that you go to a place, I want to create chaos, I can say I am positive, and all the fellows who have in contact us will become positive. Okay, so these type of things could happen. So the only thing is that when somebody becomes positive, we make them positive. We in the sense that the backend makes it positive and then extracts the information from that. So this is the only thing, and the code that is executing essentially is now released in public, and people can verify that code and see it works exactly like that, right? So the entire thing documentation, we took some 1 month to do that, but to basically write more comments and give. Please note that the whole thing was done within a month, right? So because the pandemic came, and the moment we understood about the pandemic, and the whole development has happened within a month, very rapid development, but successful development. But so the code is released, and anybody can have a look at that code, and they can find out. If there are issues, they can still write about it. The code is available as open in the code base.
Yes, so just related to the same point, just a question that just came up by Suresh Ganeshan. How different is this app from the app that's come up with Apple and Google? Because especially you in fact, in your talk, you talked about details of how you're picking up the data, geographical data, lat-long, whereas there are a lot of things that say we don't need lat-long data. We can actually do away with lat-long data and still do it. So in terms of security, they say they are more this one.
I personally has not gone through the Google and Apple, but I say that without the lat-long data, it is impossible for us to make a Google and Apple may have other ways of finding out where the person is. I need to find out. They could have other ways of finding out where the person is. The moment you put your Google Maps, where you are and etc. But I don't know how do they do that. But at least from our perspective, where we don't have any such control, there is a need for making this actionable, and for making it actionable, we need to know the latitude and longitude. Otherwise, we don't know where they are from. And if I get 200,000 traces, and callers on a day, we really don't know how to go and access. So unless we have the latitude and longitude information, it is impossible for us to take pointed action. I don't know how Google and Apple does it, but they should have some way of finding out where they are, right? And will Google and Apple are going to go to the house and basically go test them, take a temperature thing, ask for their, health, and continuously follow up? I don't know whether they are going to do, but we need to do that. And unless we know where they are, and we distribute it. So this is very important. The load balancing is very important. I need to distribute it across every pin code in the country. If we don't do that, and then it becomes a overwhelming task for a single agency to do that. So I don't have any other way. I could not think of any other way without lat-long how we could have done this better.
This is more an implementation question, but possibly it comes to privacy again. So you talked about how the data is stored with the device ID, this one. So is there a single database on the Aarogya Setu server that hosts the device ID and the phone numbers within the same table? And related to this question is this question is by Aditi Agarwal, by the way. How do medical professionals and government officials such as ICMR, doctors, etc., update patient status on the Aarogya Setu app? The lack of such a table, if they only have the phone number, does this mean that the database with the PII, name, age, gender, occupation, health history, volunteering or not, can be accessed through two means, both via the device ID as well as the phone number?
So device ID is not known to. There is a map of a device ID to a phone number that will exist in a secure server, which is not accessible to any public. Okay, so any health worker also. So the device ID will not be known to any health worker. So that is the stuff. So when a particular patient is positive, of course, the mobile numbers are added to the ICMR data. Of course, the testing lab adds it to an interface, and it comes and finally settles in an ICMR data. That's how the mobile numbers are entered. And whatever information is given out or anything about syndromic mapping, etc., are all aggregate information. There is no individual mobile numbers or anything given to that. And for actionable items, we give the mobile numbers to the health workers so that they call the people and take. So these are the 2 or 3 things that happen. So there's absolutely no way by which anybody can find out this DID belongs to this particular mobile number. Of course, the mapping will exist, but no, it's not accessible to anyone.
So this is a question from Prabhakar Rajagopal again. So how many days did it go from design to launch of the Setu app, and how big was the entire team? How large is the team that went into this?
So um, total count I can't remember, but it should be at least 50. Around so for the entire thing to stabilize, like so we had a launch. So between launch, it would have been around a month, say 4 weeks, around a month, by which the thing, all the testing and stuff like that. So it is a very rapid development. 21 days for development and then around 10 days for testing and all the certifications.
I think Uma had a question. Yeah.
Yeah, I had a question. So I was curious because I have helped a little bit with the testing. So I was curious about you know if you have an estimate of what proportion of positives, because positives would be reported by the ICMR database to you, I guess. Is that correct?
Yes.
Yeah. So what proportion of the positives are not on Aarogya Setu? Because you can link it back if that person who's positive has also downloaded Aarogya Setu. But if they have not, they are kind of ghosts, right? I mean, they're not there, they're not seen in Aarogya Setu.
Okay. So I don't have the answer immediately, but I think it's a worthwhile question. I don't have the answer immediately.
Yeah. Just wondering, because that would also be important to see what proportion of the contacts can be traced.
Oh, yeah, sure.
Yeah.
Yeah. But I don't have an immediate answer. We've not looked at it.
Yeah, sure.
This is more a social question. Maya, you have one more question? Shall I?
No, I'm good. Thanks. Yeah.
So smartphone-based contact tracing clearly has a class context, class implications, especially in the Indian context. How much was this considered and while releasing this app?
No. So see, a smartphone is because apps are there. In a feature phone, running such an app is impossible, right? So that's one first part. But then this was actually very important. So then only the one person one cell phone provider who came forward was Jio, who now got this entire thing done for their Kai OS. It's a OS that runs on the feature phone, and then we ported it onto the feature phone. But then beyond that, on a smaller handsets, like the basic version of the phones, running such an app is going to be extremely complex. It's not going to be possible, right? So this is where we stand. Right? Other than that, there are some toll-free numbers where people can call and say that I have this in the symptoms, etc. It will not be through an app, but they can still call, and then there are toll-free numbers in every state where you can helpline numbers where you call and say that there is this. That's how we can address the other section of the population. But best possible with at least the geophones, because that had a much more robust OS called Kai OS. Okay, so we could put it
on. So this is a question from Anupam Ghosh. So a lot of people turn off their Bluetooth. So is there a backup for contact tracing in the app if one switches off Bluetooth, or what is?
No, it's not possible. So Bluetooth has to be.
It has to be there on all the time. Okay. So another question is, in individuals right now, we know that they can delete their data, but can they delete their? So I don't fully follow this question. Can they delete their entire data trail if they want to from the app? And how much of such control is provided to the end user?
End user can delete everything that they want. So they don't go and delete the app, everything related to the app.
Okay.
Right. So all the data key, everything goes.
And another question related to what data is being shared. So the API was released for third parties on Saturday. This one. So what kind of data will be shared with these third parties? When
again, aggregate information will be shared.
So by aggregate information, you are referring
to something like how many people are there in this particular area, how many are there, who are there will not be there, how many are there. To have an understanding, right? And for their employees, they will insist that they put the Aarogya Setu, and then they will know that for their employee, they will know that there's a contact tracing for all their employees. But that is a normal thing. Maybe they will find out how many people are there in this vicinity, whether it's safe to operate, etc.
Okay.
Right. So in this entire process, aggregate seems to be much more sufficient to handle any of these scenarios rather than individual information. I don't really need to know who got infected, but I need to know whether there's a possibility of this area getting infected.
So this is another question from Anupam Ghosh. Actually, this is another related question also. So there's both Aarogya Setu app and several governments have also been releasing other parallel apps. For example, there's Aarogya Setu app. There is the Apta Mitra app from the West Bengal government. Each of some local governments also have their own apps. So how do these compare and contrast to each other, and why do we have these multiple apps even within the Indian context?
Yeah, so see, health is a state subject. No? So every state has its own prerogative to do whatever they feel that it is important for them to quickly get on. The reason why some people had an app because they also started looking at this before, in concurrently with Aarogya Setu. By the time Aarogya Setu was released, they would have also made it and they also released it. So that should be the reason. It's not any competition or something like that. But then the point is that each app has so if you look at, there is some app from Punjab government has a COA app. It does almost exactly same to what we Aarogya Setu does. See, ultimately, what two things? One is I am not well. I am in close proximity to other. These are two things. That's all. That's nothing big different or this. And other than what are the information that comes, all these app does almost the same thing. It's not exactly the same.
Okay. I think I've covered all the questions if asked both in the Q&A and that were asked in the YouTube channel which were posted to me. Any other questions, please? Yes. Thank you, Professor Kamakoti, for a very enlightening talk.
Thank you.
Thank you.
Thanks
for joining
Thanks
us.
a lot. Thanks a lot always.
Yeah. Bye.
Bye.
Bye, everyone. Thanks for joining us.